What's up, beautiful people? Another day, another study. The concept of cognitive resilience is that despite having pathology associated with like Alzheimer's disease or other neuropathology, some individuals have minimal or no decline in cognitive abilities. So you see things on imaging, particular types of scans where there is significant pathology, but then clinically, these people are completely fine. And we've done research in this, and we found two key components of this framework are cognitive reserve, which is performing better than expected given the pathology, and brain reserve, which is the neurobiological capacity of the brain. And many factors play into this, such as higher education level, more occupationally complex jobs. So the more complexity, the more nuance, the more brain power is devoted to your job, the better. Physical activity is associated with cognitive resilience. Your social life, which is why we always talk about being social, getting out there, being involved in communities, very important for brain health. And there are many other things that can contribute to cognitive reserve. Now, brain reserve includes factors such as greater cortical thickness on imaging, which may help attenuate the negative effects of Alzheimer's disease pathology on the brain. One of these neuroimaging modalities is something called brain PAD or brain pad. It's a surrogate marker that reflects how much older or younger a brain looks. So if your brain looks older than expected, then it's a older score. If your brain looks younger than expected, then it's a younger score. This study examined cognitive and brain reserve in relation to Alzheimer's disease pathology and cognitive function. So objective social economic status, lower education level after controlling for p-tau 217. We've talked about p-tau before. It's a marker for Alzheimer's disease pathology. It's a blood test. Brain pad, AD signature, and other confounding variables were predictive across all cognitive domains, but pretty weakly. Brain pad moderated the association between p-tau and episodic and working memory, processing speed, and attentional control. And a higher brain pad, so an older looking brain, amplified the negative association between p-tau 217 and cognitive performance. So this is an area of research we're starting to see a lot in. We're trying to predict who is at risk for developing Alzheimer's disease. We're trying to predict markers that correlate with decreased function, and then looking at how these markers change over time, how therapies affect these markers. Because in my opinion, a lot of other people's opinion, once you start to develop the cognitive signs associated with dementia, we're decades into the process. And so the best way to tackle these diseases is to prevent them with what we have right now. We may have therapies in the future that show significant improvement in enhancing cognitive resilience,